The increasing incidence of anal cancer, particularly among older women, is a disturbing trend that demands greater public awareness and clinical vigilance. Although it is still considered a relatively rare form of cancer compared to colorectal malignancies, the latest data emerging from the United States and the United Kingdom highlight a subtle but troubling rise in new diagnoses, especially in populations previously thought to be at lower risk. What makes anal cancer particularly dangerous is its capacity to remain undetected for long periods due to its symptoms mimicking far less serious conditions. This overlap often leads to delayed diagnoses, which significantly diminishes the chances of successful treatment and recovery. One of the most pressing concerns is the confusion of early symptoms with benign disorders like hemorrhoids, anal fissures, or even irritable bowel syndrome. For example, anal bleeding, perhaps the most commonly reported symptom, is frequently attributed to hemorrhoids or minor tears caused by constipation. Many individuals dismiss it as inconsequential, self-treat with over-the-counter remedies, and fail to seek medical evaluation. Similarly, persistent itching, mild pain, or the presence of small lumps around the anus may be brushed off as dermatological irritation, poor hygiene, or infections. Unfortunately, by the time the symptoms worsen or persist long enough to prompt a medical consultation, the cancer may have already progressed to an advanced stage, making treatment more aggressive and outcomes less favorable. Another significant issue is the lack of awareness about the virus that causes the majority of anal cancer cases, the human papillomavirus, HPV. Despite decades of research linking HPV to cervical and oropharyngeal cancers, its role in anal malignancies remains underappreciated by both the public and many healthcare providers. The sad irony is that HPV-related cancers are among the most preventable, thanks to the availability of highly effective vaccines. However, many older adults, particularly women over 65, the demographic now seeing the fastest rise in cases, were never offered or encouraged to receive the HPV vaccine when they were younger, as vaccination campaigns only gained momentum in recent decades. Consequently, they now find themselves vulnerable to infections that could have been prevented with earlier intervention. The latency period of HPV infection complicates this further. The virus can remain dormant in the body for years or even decades before triggering the cellular changes that lead to cancer. This long delay creates a false sense of security among those who may believe they're no longer at risk simply because they were exposed years ago without issue. Moreover, HPV testing and screening for anal lesions are not yet common practice outside of certain high-risk populations, such as men who have sex with men or individuals living with HIV. This leaves a large swath of the population, including many older heterosexual women, undetected and unprotected. The potential for misdiagnosis or underdiagnosis is also heightened by a widespread discomfort in discussing anal health. There is still a considerable social stigma surrounding anything related to this part of the body, leading many people to avoid speaking openly with their healthcare providers about symptoms they find embarrassing. Even among clinicians, there may be a reluctance or lack of experience in conducting thorough examinations or recommending further tests like endoscopies or biopsies. This systemic discomfort acts as yet another barrier to early detection. Adding to the concern is the relatively aggressive nature of anal cancer when left untreated. It has the potential to spread quickly to nearby lymph nodes or even metastasize to distant organs. Standard treatments, such as radiation and chemotherapy, can be physically and emotionally grueling, particularly for older adults who may already have other health complications. Furthermore, the anatomical location of the tumor can lead to long-lasting complications, including pain, fecal incontinence, and damage to surrounding tissue that significantly affects quality of life even after successful treatment. While advances in oncology and immunology have improved survival rates in many cancers, anal cancer still faces challenges due to a lack of widespread screening programs and public education. Unlike cervical cancer, where Pap smears and HPV testing have become standard, there is no equivalent protocol for anal cancer, leaving detection highly reliant on patient self-reporting and clinical suspicion. This reactive rather than proactive model of care is inadequate in the face of rising incidence rates. The takeaway from this trend is clear: vigilance and awareness must improve. The public must be educated on the symptoms of anal cancer, particularly when those symptoms overlap with common conditions. Patients should be encouraged to overcome embarrassment and report rectal bleeding, pain, and persistent discomfort without delay. Clinicians should be better trained to recognize subtle signs, initiate appropriate diagnostic tests, and discuss HPV vaccination with patients of all ages, not just teenagers. There is also an urgent need to expand access to screening programs, especially for populations now shown to be at increasing risk. If the current trend continues unchecked, we could see a sharp rise in late-stage diagnoses and a corresponding increase in preventable deaths. Anal cancer is not merely a statistical anomaly. It is a public health issue that must be addressed with urgency and honesty. Would you like to explore HPV vaccination recommendations or information on early screening options?